everyone, welcome to my channel Anupma Biology classes. In this video, our topic is cancer. This video is taken from Immunology series of CBSE class 12th, chapter 8, part 5th. So let's come on the topic. The question is, according to the video, that what is cancer? Cancer may be defined as a malignant growth or enlargement of a tissue that occurs due to unlimited and uncontrolled mitotic divisions of certain cells and invades surrounding tissues. In short, cancer is mitosis run amok. So, cancer is a group of disease involving abnormal cell growth with the potential to invade or spread to other parts of the body. Cancer develops when the body's normal control mechanism stops working. Old cells do not die and instead grow out of control, forming new abnormal cells, and these extra cells may form a mass of tissue that is known as tumor, which you can see in the picture, that is formation of tumor. Cancer is a dreadful disease. It is one of the chief killers today. It is most common in the people between 40 to 60 years of age, but may occur at a younger age also. It commonly originates in the tissues in which the cells are regularly replaced by mitosis. These tissues include skin, lining of digestive tract, reproductive organs, lungs, and liver. Normally, the cells of a given tissue divide at a certain fixed rate and is controlled manner. For instance, the cells lining the gut are replaced completely every 36 hours. Skin cells every few days and the red blood corpuscles every few weeks. Sometimes, for a reason which is not clear yet, mitosis occurs in these tissues at rate far above the normal and in an uncontrolled fashion. This results in an abnormal growth called tumor and also known as neoplasm, which means new growth. In the cancer of the white blood corpuscles, which is known as leukemia, no tumor is formed. Here, multi-stage chemical carcinogenesis can be conceptually divided into 4 stages. That is tumor initiation, tumor promotion, malignant conversion, and tumor progression. So in the process of carcinogenesis, which is also called oncogenesis or tumorigenesis, is the formation of cancer whereby normal cells are transformed into cancer cells. The process is characterized by changes at the cellular, genetic and epigenetic levels and abnormal cell division. Now here you can see the stages of cancer. So there are mainly 4 stages, in which the first stage, before this is stage 0, which is carcinoma in situ. The cancer cells have not yet invaded into surrounding tissues. Without invasion, the tumor can't spread and the cure rate is 100%. Then stage first, the primary tumor is small but invasive into the surrounding tissues and has not spread. Then stage second, the primary tumor is larger but there is still no clinical evidence of a spread. Then stage third, the tumor has spread to lymph glands in that region of the body. Then stage fourth, the cancer has spread beyond the region where it intillated to a distant tissue or organ. So here in this picture you can see the progressive spread of an intestinal cancer and its invasion into surrounding tissues. So there are 3 stages of the colon cancer, and here in the first stage the tumor is small and has not penetrated the layer of cells lining the colon. Then in second stage the tumor has penetrated the muscle wall of the colon. Then in stage third the tumor has spread to nearby lymph node. So this is all about the stages of cancer. Here you can see the pulmonary carcinogenesis. At first, the activation by carcinogens, then DNA adduct formation, then mutation, epigenetic genes inactivation, then growth suspension, evasion, apoptotic resistance, sustained proliferative signaling, and then angiogenesis. But in reverse direction, which means tobacco cessation or chemoprevention to promote repair, At first, growth factor inhibitors, anti-angiogenic, pro-differentiation, anti-proliferative strategies, then gene demethylation, histone deacetylase inhibition, then DNA repair occur, and after that, the carcinogen inactivation and excretion occur. So this is all about the pulmonary carcinogenesis. After this, now types of tumors. So tumors may develop anywhere in our body. However, all tumors are not cancerous. There are two main types of tumors in which the first one is benign tumor and the second is malignant tumor. So what are the main difference between the benign and malignant tumor? Benign tumor grows slowly throughout. It remains confined to the site of its origin. It remains intact. It is non-cancerous. While the malignant tumor, it grows first slowly, then rapidly. It extends into neighboring tissues. Its bit breaks off, move with the blood or lymph to other parts to invade new tissues and form secondary tumors. Now, what are the benign and malignant tumor? So, benign tumor grows slowly, may attain quite a large size, but it remains confined to the site of its origin and does not spread to other parts of the body. While malignant tumor first grows slowly, no symptoms are noticeable at this stage, which is known as latent stage. Then the tumors later grows rapidly. The cancerous cells compete with the normal cells for the nutrient and finally kill them. Rapid growth of the tumors causes overcrowding and disruption of the normal cells. Still later, it extends to the neighboring tissue like the roots of a tree. In the last stage, bits of the tumor tissue breaks off and are carried by the circulating blood or lymph to other parts of the body where they invade new tissues, and this process is known as metastasis. So, benign tumor slowly growing mass while the malignant has rapidly growing mass. Benign has regular surface capsulated non-attached to the deep structures while the malignant has irregular surfaces non-capsulated attached to the deep structures. Benign is non-invasive to another organs or tissues while the malignant is invasive to other organs. There is no recurrence after surgery in the benign while the recurrence after surgery in malignant occur. Benign has no spread or metastasis while the malignant show spread and metastasis. In benign, there is no bleeding in cut surfaces, while bleeding from cut surfaces is common in the malignant. So, these are the main differences between the benign and malignant tumor. Now, types of cancer. So, there are three main types of cancer in which the first one is sarcomas. Here, it is of three main types: lymphomas, lipomas, and osteomas. Second type of cancer is carcinomas. Here, breast cancer, lung cancer, pancreatic cancer, stomach cancer, etc. And the third type is leukemias. So, here you can see that in case of sarcoma and their type. Sarcoma are different type. So, what is sarcoma? Sarcomas affect the tissues derived from mesoderm such as connective tissues like the bones, cartilages, tendons, adipose tissues, lymphoid tissues and muscles. Here you can see that some common examples of the sarcomas like lymphomas. Lymphomas are the cancer of the lymphatic tissues. They appear in the lymphatic nodes, spleen and reticuloenodoepithelial tissues. Second is lipomas. Lipomas are tumors formed in the adipose tissues. And then osteoma, it is the cancer of bones. After this, there are many also sarcomas like the angiosarcoma, osteosarcoma, Ewing sarcoma, chondrosarcoma, gastrointestinal stromal tumors, then fibrosarcoma and hemangioendothelioma. So these are the types of sarcomas. Now, carcinomas. Carcinomas affect the epithelial and glandular tissues. They include breast cancer, lung cancer, pancreatic cancer, stomach cancer, etc. So, what are the main difference between the sarcoma and carcinoma? Sarcoma affects the tissues derived from mesoderm, like connective tissues and lymphoid tissues, while the carcinoma affects the epithelial and the glandular tissues derived from the ectoderm, like the examples like the breast cancer, lung cancer, stomach cancer, etc. So here you can see the lobular carcinoma. It means breast cancer, and it's a type of carcinomas, means the affected epithelial and glandular tissues are present in this type of cancer. Now leukemias. Here you can see a normal blood type and the leukemia person's blood. Leukemias result from the excessive formation of WBCs in the bone marrow and lymphatic nodes, increasing their number in the blood. So, besides the above, highly malignant tumors form from primitive embryonic tissue in infants and children. This includes tumors of eye, kidneys, and cerebellum. After this, now some possible symptoms of cancer. So, cancer can be treated if detected in its early stage. So, therefore, one should consult a doctor if any of the following symptoms are found. In which the first symptom is any wound that does not heal in a normal time, bleeding from any body opening, a lump or hard tissue which changes or grow larger, persistent indigestion or difficulty in swallowing, persistent changes in bladder or bowel habits, progressive change in the color of a wart or mole, persistent hoarseness or cough, excessive loss of blood in menses in women or loss of blood outside the normal date, a swollen or sore throat which does not heal easily, unexplained loss of weight, unexplained low grade fever, unexplained reduction or loss of appetite. So, the above symptoms may or may not mean cancer and should not cause under worry. So, in our country, the major forms of the cancer in men is the mouth and the throat cancer, and in the women, uterine cervical cancer. So, these are the mainly possible symptoms of cancer. Now, after this, causes of cancer. So what are the causes of cancers? Here you can see there things you can do to reduce your risk for cancer. That avoid tobacco, eat healthy diet, drink in moderation, stay active, breastfeed to reduce mother's cancer risk, ensure your children get hepatitis B and HPV vaccines, take part in cancer screening programs, avoid too much sun and use protection. So, what causes genetic changes occur? So, there are many causes like the heredity, viruses, UV radiation, smoke, chemicals, and the cell dividing. So, there are many cases, many causes like the constant irritations, like constant heat, bitter and tobacco chewing, heavy smoking, jagged teeth may cause tongue cancer, excessive exposure to sunlight may cause skin cancer in farmers and livers, then some chemicals which induce cancer, then radiations like the X-ray, cosmic rays, ultraviolet rays are also carcinogenic, and some viruses. At present there is no definite evidence that any human cancer is caused by a virus. However, certain animal cancers are known to be induced by a virus. Now there are some cancer myths busted. So, which cannot causes cancer and can cause cancer? So, which cannot cause cancers are electromagnetic frequencies, genetically modified food, microwave ovens, drinking from plastic bottles, stress and the food additives. While which can cause cancer? So, is smoking, second-hand smoke, sunburn, drinking, unsafe sexes. So, these are the cancer myths. Now you can see how much the percentage which causes cancer. Alcohol causes 3% cancer, radiations 1%, diet 35%, tobacco 30%, sunlight 10%, others 10%, viruses 7%, occupational factors 4%. So these are the percentages of the causing organism or the substances or the causing materials which causes cancers. Now, after this, treatment of cancer. So, if you talk about the treatment, cancer is neither contagious nor hereditary. What causes cancer is not clear yet. Many factors are, however, known to favor cancer development. These are called carcinogenic agents or carcinogens. These are mostly environmental pollutants. So, anything which affect mitotic rate can be a carcinogen. So, in case of cancer, treatment options are hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, immunotherapy. Here you can see that palliative care of the cancer, pain management, care of terminally ill patient, psychological and spiritual support, end of life care. Radiation therapy like IMRT, IGRT, 3-DCRT, stereotactic radiosurgery, brachytherapy. In case of chemotherapy, cytotoxic drugs, immunotherapy, and targeted therapy. And in case of surgery, open surgery, laparoscopic surgery. So in surgery, ideal for removing cancer, type of surgery depends upon the extent and location of cancer and whether the patients want to have children in future. In case of chemotherapy, it uses medicine to kill cancerous cells. Chemotherapy can be very useful in treating advanced stages of the cervical cancer. In case of radiation, use implants in the vaginal cavity or high dose X-ray to kill cancerous cells. And in case of chemoradiation, this is basically a combination of chemotherapy and radiation therapy. It is commonly used to treat both early and late stages of cervical cancer. So this is all about the treatment of cancer. Now, carcinogens and the organ affected. So here you can see some carcinogens and their organs affected. Like if we talk about the shoot, it affects skin and lungs. Coal tar affects skin, lungs. Cigarette smoke affects lung. Cadmium oxide affected organs is prostate gland. Aflatoxin affect liver. 2. Naphthylamide and 4. Aminobiphenyl, it affects urinary bladder. Mustard gas affects lungs. Nickel and chromium compounds, asbestos, both also affect lungs. Diethyl stilbestrol, that is DES, it affects vagina, and the vinyl chloride, that is VC, affects liver. So these are some carcinogens and the organ affected by it. Now, after this, what are the characteristics of cancerous cells? So, the cancer cells resemble the normal cells in their ability to divide, in the manner of division and in the phase of cell cycle. However, the cancer cells have some characteristics to form tumor, in which cancer phenotype and stem cells, here you can see, they disobey the growth control, that is proliferate rapidly, escape from death signals, immortality, imbalance between cell proliferation and cell death, that is excessive growth. Then loss differentiations properties, no functions, are unstable, newer mutations overrun their neighboring tissues, invade locally, and have the ability to travel from the site of origin to other part of the body, that is distant metastasis. So according to characteristics of tumor, there are some characteristics like majority of neoplasm can be categorized clinically and morphological into benign and malignant on the basis of certain characteristics which are listed below. Rate of growth, cancer phenotype and stem cells, clinical and gross features, microscopic features, local invasion, that is direct spread, and the metastasis, that is distant spread. So, cancers have different characteristics, that is continue dividing ceaselessly, divide in an uncontrolled manner, do not undergo differentiation, form an ever-growing tumor by accumulation, do not remain confined to the part of the body where they are formed, invade the neighboring tissues and dislocate their functions, finally spread throughout the body forming secondary tumors. Thus, cancer is an unorganized growth without or with ineffective control mechanism. So, deep-seated ulcerated mass, fungative ulcerated mass, ulcer margins commonly elevated, adjacent tissues commonly filmed to palpitations, may be residual leukoplakia and erythroplakia, continuous enlargement, more common in adult males, positive cervical lymphoadenopathy may be present, local pain, referred pain, and presthesia are the clinical features of the cancerous cells. Now, after this, cancer detection and diagnosis. So, how can we detect cancer and how can we diagnose it? So, early detection of cancer can help in the successful treatment in many cases. Cancer detection is based on biopsy and histopathological studies of the tissues, blood and bone marrow test for the increased cell counts. Biopsy of the tissue is done by taking a piece of tissue and examining its thin stent section under microscope. To detect cancer of internal organs, techniques like radiography, CT that is computed tomography and MRI that is magnetic resonance imaging are very useful. Cancer is at present treated in three main ways, in which the first one is surgery, that is removal of the entire cancerous tissue. Next is radiation. Radiations means that is exposure to X-ray which destroy rapidly growing cells without harming the surrounding tissues. And then chemotherapy, that means administrations of the certain anti-cancer drugs. These drugs check cell division by inhibiting DNA synthesis or are more toxic to cancer cells than to the normal cells. A few cancers respond well to specific treatments, but most cancers are treated by combination of surgery, drugs and radiation therapy. So here you can see that the chemotherapy drugs can block hormone attachment to their receptors and the block growth. So the hormone receptor binding block is stop growing, receptor positive cells may stop growing with chemotherapy treatment. So this is the cancer detection and the diagnosis. Now what is leukemia? Leukemia is a cancer of leukocytes forming tissues, that is in bone marrow and lymphatic nodes. Leukocytes are formed in the normal manner, and here in this picture you can see that is normal blood and the leukemic blood. Bone marrows become so crowded with the white cells that the formation of red corpuscles is decreased. Fall in hemoglobin adversely affects the metabolism. Leukemia is fatal. Bone marrow transplant has now provided cure for the leukemia. So what are the common symptoms of leukemia? Unexplained fever, headaches, abdominal pain, bone joint pain, frequent infections, unintentional weight loss, bruising or excess bleeding, fatigue, enlargement lymph nodes and the night sweats are the common symptoms of leukemia. Now, after this, theories of cancer. So, two theories are worthy for the mention, in which the first one is mutation theory. Accumulation of mutations over the year produces cancer. Now, here you can see in case of mutation theory, here normal cells, then here pre-neoplastic lesions, then the clinical cancer and invasive metastasis, which means initiation, then promotion and then progression. So these are the stages of the cancer, and here some mutagens like the chemical, physical and biological agents which are responsible for causing the initiation of cancer. Now, selective gene activation theory. Certain genes that are not normally expressed suddenly become active and their products causes cancer. So, according to this idea, is that new species are formed from the sudden and unexpected emergence of alternations in their defining traits. So because of this, here this is the selective gene activation theory, and the reverse mutations or inactivation of the activated genes may causes remissions, that means disappearance of disease. So this is the end of video in which we know about the cancer, types of tumors, type of cancers, causes of cancer, characteristic and treatment of cancer, and here here detection and diagnosis, leukemia, way of treatment, etc. So if and the next video here will be on addiction. So if you understand this video, please like and share it and subscribe to my channel, my biology classes. If you have any questions, any quiz or any suggestions, you can ask in the comment section below. Thank you for the watching.